Hi everyone, welcome back to our weekly series on diabetes. This week we're going to be talking about exercise and physical activity in diabetes and just the importance of exercise overall. And I thought the best person, and we thought the best person to help deliver this would be our wonderful physiotherapist, Chetan. How are you, Chetan?
I'm not too bad. How are you, Dr Nik?
Yeah, good, thank you. Good. So I think you're the man really for the next for this episode. So tell us more about your job and patients that you see with diabetes and the importance of exercise with diabetes and overall for your general health.
Well, Nick, I'm what we call a first contact physiotherapist, kind of a new role in primary care or in GP practices. It's like being a kind of a GP or the first point of contact for muscle and joint issues. So you can call or through triage, book in to see ourselves. If you've got knee problems, lower back pain, shoulder pains, those three body parts are probably the three most common regions which we get bookings for.
Cool. Now, the reason I asked you to come in and have a chat with us today was because I think exercise is crucial not only for our overall health but especially in lowering our blood sugar. And this is a message we always drill home, along with diet and exercise for patients with diabetes and sort of what we call pre-diabetes. Would you be able to just talk us a bit more about how important the importance of exercise for these things?
Absolutely, Dr. Nik. One key thing emerging in the musculoskeletal field is the link of diabetes causing some inflammation in the body and that resulting in muscle aches and pain. So that is an emerging area of research and amongst the musculoskeletal research. What does exercise do for diabetes? Exercise uses up glucose, which is very important in diabetic control. The more active we are, the more the muscles are using the blood glucose that's going around the body. And if you are in a trained state, so exercising for a longer period of time, weeks or months or even years, then the muscles in the body get bigger. Bigger they are, the more they can store glucose. And these muscles get better at absorbing the blood glucose or glucose from the blood. And they also get better at more efficient at using insulin, i.e. that you need less insulin to make the muscles absorb blood glucose. Okay.
So if we exercise more, so essentially our body uses the glucose as fuel, and in theory will then reduce our blood sugar over time. Is that right?
Yeah.
Well, instantly and over time.
Yeah. And that's key what you've just said. There's actually very good evidence that even in the short term, i.e., for example, walking 5-10 minutes after a meal can have a very positive effect on blood glucose control. And also over longer and more of a trained state or more of an exercise state, that process just gets better and better. So even if you're, let's say, maybe not been exercising or it's new to you exercising, even if you can incorporate those short walks after meals, can make real positive changes.
Okay, great. And do they need to just be, so people will say, oh, I often, I go for walks. Do we need to walk at a certain pace, or can it be a leisurely pace? Does it need to be a brisk walk?
Yeah.
Well, what would you suggest?
Really good points there. I would say we need to consider each person individually. And if walking can be a challenging exercise for some, and if that's quite challenging already, then any sort of walking would be a really good thing to do.
Okay.
Because it's quite challenging. But if for those that may find walking a bit easier, what I would like to encourage is if people can get their heart rate going, build up a bit of a sweat, that can have some added benefits.
Fine. Okay. And leading on from walking, I'm assuming for those that are able to, and I appreciate it's something that needs to be built over time, but jogging and running can be a very good form of exercise as well, not only for your overall physical and cardiovascular health, but also for diabetes and diabetes control.
Yeah, absolutely brilliant forms of exercise. The guidance in terms of exercise is aiming to do 150 minutes of exercise.
Yeah,
that does sound quite a lot, but it can be broken down into chunks. There's no perfect way of doing it, and the guidance is kind of designed on each individual to decide what's best for them and their sort of work, social scenarios, whether it means doing 5 days of 30 minutes of exercise or 3 days of 50 minutes of exercise. 150 minutes is the key target for lower level activities. But if you are doing something vigorous, as you mentioned, running or playing squash, then you can do 75 minutes of exercise. They're the kind of target levels.
Okay. All right. And I think it's important just to remember as well, often when people think of exercise, they think of going to the gym or actually lifting weights or anything, but actually commuting to work and getting off 4 bus stops early and then walking the rest of the way, that is, we've just spoken about, considered a form of exercise, isn't it? So it doesn't need to be as in you have to set aside time to do this. You can just incorporate it into your daily activities.
Absolutely. Yeah. If we can get that target of 10,000 steps, as you mentioned, walking a few steps, getting off the bus a little bit earlier, commuting, walking after meals. If we can get that 10,000 target of steps, that's shown to have a real good mark on helping blood glucose control, which is really important.
So outside of the gym, Chetan, are there some basic, this is a question I get asked a lot, and I'm sure a lot of us do. Are there any basic forms of exercise that people can do at home without the need of any equipment that can, help them with their overall physical health or in the long term help lower their blood sugar control?
Yeah, absolutely. Going back on that 150-minute guidance, part of it you can get through walking, which is really good. But the guidance also suggests if we can do a couple of sessions of strengthening or body weight resistance exercises, that would be strongly encouraged to incorporate some of those. And there we can definitely incorporate exercises to do at home.
And what kind of exercises would you be thinking about? I often just, I'll tell you what I say to my patients. So often just body weight squats, I feel, are a good form of strengthening your lower legs and also just generally for your overall physical health. I also advise sometimes when possible, going up and down the stairs a couple of times a day, just for the fun of it, really. Sorry.
Absolutely brilliant. I mean, all those exercises you described are they work the anti-gravity muscles. They're the ones which are important for your balance. Almost everyone has to sit and stand 20, 30, 40 times a day. So it's a really great exercise to work those muscles around your buttocks, around your quads, and your legs generally. So that's definitely one. Incorporating some calf raises is a really nice, easy exercise to build the calf muscles. They're more your walking muscles. So they would definitely be good.
And how would you do that? How do you?
Yeah. Should we demonstrate? Or
please do. I mean, I've actually don't have a calf muscle at the moment. Not a functioning one anyway. But if you could.
So we'll go for the sit to stand exercise that you mentioned. So we can make things, we can get a standard chair or a chair with a little bit higher or lower, and that can make things harder or easier. So you can come to the edge of a chair. You can have a chair with arms, so we can use that if we need to. So this is quite a good exercise we can make harder or easier according to the individual in question. So it's a sit to stand exercise. So you can come to the edge of your seat. You can use a chair with arms. I'm gonna cross my arms over my shoulders or over my chest, and then lifting up nice and slow, leaning forward, lifting up slowly, and then slowly lowering back down, sticking your bottom out, lowering back down, and then just keep repeating until you're tired. I don't like to give a number of 5, 10, 15. Everyone's individual. So work out a number where you get tired. Then I'd probably rest for 3-4 minutes, maybe do it again, or definitely do it again, rest again for 3-4 minutes, and then maybe one more time until you're tired.
I think that's the kind of message we've been trying to get across the last few weeks. It's small changes. So like you said, set yourself a number, and then the next week try and increase it by a little bit. And before you know it, you'll be able to do hundreds.
Well, that's a big target. That's definitely the aim.
And anything for the upper body you'd suggest?
Upper body, yes, definitely. I would definitely suggest a wall press up of some sort. I wonder where the best place to do this exercise is.
Be able to got space to demonstrate this.
Wall here. So unfortunately, I'll have to turn around. Hands on the wall. just finding a distance where if you bring your feet closer, it's a bit easier. A bit feet further away is a bit harder, and then just slowly lowering yourself towards the wall.
Okay.
And then coming back up. You use your arm muscles and your chest muscles. And nice to put a bit of weight through your arm as well. So repeating until you're tired.
Mm-hmm.
And that formula of 3 sets with 3-4 minute rest in between, 3 days a week. Pretty good target.
Oh, good stuff. So we've talked about the cardiovascular exercises. So walking, running, anything else? Cycling is another great.
Yeah. One thing I would like to say is always choose an exercise or that you enjoy doing. And if you enjoy doing it, you're more likely to do it over a longer period of time. So rather, it would be best for individuals to choose which exercise they prefer doing it, just because they're likely to do it longer.
But examples of these exercises would be
they're all
cycling, swimming, running, brisk walking,
rowing. They're all cardiovascular exercises.
Good.
And then these are all resisted exercises using your body weights, which some of them we can incorporate by holding a light weight to make them a little bit harder. So they're the two different types of resistance exercise and some cardiovascular exercise.
Okay. I think that's really helpful stuff, and hopefully, a lot of this can be done just from the comfort of your own home, which is good. Is there anything else that you wanted to add, or you think may be beneficial?
No, I think the key thing, especially I've learned recently, is there is some very good evidence that walking 5-10 minutes after a meal, or walking 4-5-10 minutes after having a meal, can have a very good effect. So that's a small change.
So it's a take-home message for everyone watching.
Make a big difference in controlling blood sugar levels, and then regular exercise, which build the muscles. Your body gets more efficient and controls the blood glucose pretty well, or quite effectively and efficiently. So they're the kind of key take-home messages from myself.
Fantastic. Thank you. Thanks a lot.
Brilliant.
Is there any questions anyone has? So the question is if there's one, number one, have we got one take-home message or top tips that, for exercise, how much we should be doing, and the guidance for it? Just to summarize everything we've just spoken about.
I might try and give maybe 3 or 4 tips.
Okay,
hopefully.
Perfect.
Number one would be a walk. Have a walk 5-10 minutes after a meal. That will make a big difference to blood sugar control.
Okay.
Number 2, aim for 150 minutes of exercise, or 150 minutes of light exercise and 75 minutes of more vigorous exercise.
Per week.
And 2 of those sessions should be some sort of resisted body weight exercises.
Okay.
And the third one is choose an exercise you enjoy doing.
Okay.
So very important. The more you enjoy it, the more likely you're going to commit to it.
Absolutely.
And more likely you're going to get the benefits of exercise for general health. So many general health benefits, but also specifically for diabetes as well.
Great. Good stuff. Thanks for joining us today.
No worries. Pleasure.
It's great stuff.
Nick, do you want to give some top tips?
Yeah. Don't play tennis.
You're making a good recovery.
Your calf raises. I'm gonna have to try them soon.
Yeah, I hope you find a good physiotherapist.
Yeah, so do I.
Right. Thank you, guys.
Take care, everybody. See you next week.